Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hepatic encephalopathy, we are looking at the grading of the West Haven criteria. So the clinical grade, we start with the minimal. So we are starting with minimal. So under minimal, there are some clinical changes such as the abnormal psychometric or neuropsychological test. So we perform the abnormal psychometric or the neuropsychological test. Neuropsychological. So abnormal psychometric or the neuropsychological test. And other thing to notice, there is no clinical manifestation. There is no presence of clinical manifestation. Now, what is the category? The category of this is nothing but the covert HE. This is the category. Now we move on to minimal is over. Now we move on to the grade 1. So here in grade 1, there is altered sleep pattern. So there is a altered sleep pattern, and then there are some changes in the behavior. So altered sleep pattern, there is a change in the behavior. Next is presence of slurred speech. There is slurred speech, as well as there is a mild confusion. So mild confusion is present. Now when you look at the category, it is the covert HE. Now we move on to the grade 2. So in terms of G2, that is grade 2, there is a disorientated and the lethargic. So the individual becomes disoriented, as well as the patient is lethargic. So disorientated and then lethargic. The patient presents with the inappropriate behavior, as well as there is asterixis. Now, what is the category here? Category here is the overt HE. Then we saw the G2. Now we will move on to the G3. So what is G3? So G3, the features, it includes the stuporous. The feature, it includes the stuporous. Then it responds to the pain and the voice. So it responds to the pain as well as it responds to the voice. Next is it involves a gross disorientation. There is gross disorientation. So what is the category here? The G3, the category is nothing but it is going to be the overt HE. Next we saw the G3. It involves the response to the pain, voice, gross disorientation and OTT. Now we will move on to the G4. G4 is the grade 4, and here it is unresponsive to the voice and pain. So in grade 3 it responds, but as here it is unresponsive. So unresponsive to the voice or also the pain. Next is it is also in comatose. So what is the type here? The category would fall under the overt HE. To learn and grow daily like this, please do subscribe.